Are you interested in learning about drugs and their effect on the brain? Well, even if you aren't, that's too bad. First up are the categories of drugs. Stimulants are a type of drug that speed up communication between the brain and the body. This causes the person to feel more awake and energetic. Symptoms of this drug include intense happiness, more confidence, a higher heartbeat, eating less, sexual excitement, mood swings, anxiety, a feeling of well-being, and dehydration. Some examples of stimulants include amphetamines, cocaine, and crystal meth. Depressants are a group of substances that cause the central nervous system, which is made up of the brain, spine, neurons, and neurotransmitters, to slow down. Some examples are cannabis, which is THC, also known as weed, alcohol, and opioids, such as OxyContin, heroin, and fentanyl, which can sometimes be given by a doctor. Some symptoms include impaired judgment, confusion, and physical signs like drowsiness and unsteady movements. Hallucinogens, aka psychedelics, make a person see, feel, and hear things that aren't real or distort their interpretation of what's going on around them. Users can feel detached from their bodies and surroundings, hallucinate, and or experience alterations in their views of the world around them. Some examples of hallucinogens are LSD, shrooms, ecstasy, and ketamine. Marijuana is unique because it can act as a depressant, stimulant, or hallucinogen, depending on the person. Normally, nicotine can sometimes act as a depressant or a stimulant.
Now let's talk about different types of neurotransmitters and what they do in the brain. Neurotransmitters act as chemical messengers in the brain. They transmit signals across synapses, which are the spaces between nerve cells, and that allows for the flow of information through the brain. Adrenaline or epinephrine are released in stressful situations. They cause higher awareness and higher athleticism. Norepinephrine plays a crucial role in alertness, attention, and stress responses within the brain, causing an increase in blood flow. Dopamine is associated with pleasure and can cause addiction. Serotonin relates to well-being and happiness. GABA relates to calming emotions. Acetylcholine is responsible for learning, memory, and attention. Glutamate helps develop nerve cell connections. Lastly, endorphins are released during exercise, excitement, or sex. Connecting the two, we're going to look at how drugs affect different neurotransmitters and cause addiction. Depressants mainly increase levels of GABA, but can also affect dopamine and endorphins. This leads to slower brain activity. Stimulants mainly increase dopamine and norepinephrine, but can also affect serotonin and glutamate. This increases the levels of these neurotransmitters in the synapse by promoting their release. This can lead to higher focus, energy, and happiness, making them addictive. Hallucinogens bind to and activate specific serotonin receptors by mimicking serotonin in the brain. They can also affect glutamate.
Next is how addiction occurs in the brain. Addiction is due to the fact that drugs can interfere with the methods that neurons use to send, receive, and process signals through neurotransmitters. For instance, drugs such as marijuana and heroin mimic the natural neurotransmitters in the body and allow the drugs to attach onto and activate neurons. Regardless, drugs activate neurons in different ways than natural neurotransmitters do, and as a result lead to abnormal messages through the network. On the other hand, drugs like amphetamine or cocaine cause neurons to release an excessive amount of natural neurotransmitters, thus amplifying or disrupting the normal connection between neurons. Brain areas affected by drug usage include the basal ganglia, prefrontal cortex, and the amygdala. The basal ganglia is known as the reward circuit. Drugs overactivate this circuit, producing the euphoria or extreme happiness of the drug high. If overexposure continues, the circuit begins to adapt to the presence of the drug, creating a higher tolerance and making it difficult to feel pleasure from anything besides the drug. The amygdala, on the other hand, plays a role in stressful feelings like anxiety, irritability, and unease, which characterize withdrawal after the drug high fades and thus motivates the person to seek the drug again. The circuit becomes increasingly sensitive with increased drug use. Over time, a person with substance use disorder uses drugs to get temporary release from this discomfort rather than to get high. The last brain region that we'll be discussing is the prefrontal cortex, which controls the ability to problem solve, make decisions, and use self-control when needed. It's the last part of the brain to mature, which is why younger audiences are considered most vulnerable.
During adolescence, the brain is still developing in areas responsible for memory, impulse control, emotion, and decision-making. A key part of this development is the formation of myelin, which is a protective, fatty coating around brain cells, neurons, that helps messages travel quickly. However, myelin is not fully developed in teenagers, making their brains more sensitive. When teens use drugs like marijuana, it can interfere with the development of myelin, leading to lasting issues with memory, learning, and information processing. Since their brains are still forming, adolescents experience both positive and negative emotions more intensely than adults, which makes drug use feel more powerful, causing them to be more addictive. Over time, this can disrupt normal brain growth, reduce their ability to plan ahead, complete tasks, and make decisions. Long-term consequences of early drug use during adolescence can include a permanent decline in IQ, slow reaction time, reduced coordination, emotional instability, difficulty forming relationships, and a significantly increased risk of developing a substance use disorder later in life. How does tolerance and withdrawal occur? Tolerance is created with long-term use and dependence. It affects the brain negatively, and eventually the brain will not be able to create a certain amount of neurotransmitters or a stable amount, such as before drug use. Initially, when the drug is first taken, the body freaks out. This puts a cap on the amount of neurotransmitters that the brain can produce itself. Every time the drug is taken, there's a cap put on the neurotransmitter again. Eventually, the brain cannot make the neurotransmitter itself. When the drug is not taken, the individual may feel they cannot function normally. After being off the drug, the brain can regain the ability to make the transmitter at a stable amount, but this takes a large amount of time, such as years. The body adapts to the amount taken, giving it less of an effect. Without an increased dose, withdrawal symptoms arise. Some symptoms include irritability, insomnia, anger or aggression, depression, decreased appetite, nausea, and drug cravings.
Resources for those struggling with addiction include inpatient treatment, outpatient treatment, residential treatment, peer support programs, and the 12-step programs. Inpatient treatment involves someone staying at a treatment center during their detox. They receive therapy and work on coping mechanisms, which allow patients to live in a safe environment and away from temptations that may lead them back to addiction. Outpatient treatment involves scheduling appointments at a treatment center, which allows more flexibility with one's life. This can also make the patient feel less isolated and retain/rebuild the routine of their daily life. Residential treatment is similar to inpatient treatment, but it takes place in a homier setting. It's classified as a non-hospital care center, meaning it resembles a home while still letting the patient receive therapy and coping mechanisms. 12-step programs allow people to get help in whatever way they need and gives them a person to turn to that's experienced in recovery, aka a sponsor. The steps of the program include admitting one's problem, making amends with those they have wronged, and helping other people that also have addictions.
Thanks for watching. Y4Y hopes this helped you understand the effects of substances.
Don't do drugs, kids!